Hello, good evening, and you're very welcome to the RCSI University of Medicine and Health Sciences in Dublin here tonight. We are going to be talking about tobacco and alcohol and their impact on human health. This is the second of a three-part series on positive health as part of the RCSI's series of MyHealth public lectures. This series aims to bring together top researchers and practitioners in the field of positive health to help empower with knowledge people to know how to make good decisions and informed decisions about their own health and well-being. Tonight, around the round table, we have Dr Gráinne, who's Senior Lecturer at the School of Pharmacy and Biomolecular Sciences at the RCSI, Dr Ross Morgan, Consultant Respiratory Physician and Honorary Clinical Associate Professor in the RCSI and Beaumont Hospital, and Professor Ciara O'Boyle, Director of the newly established RCSI Centre for Positive Psychology and Health, to discuss this subject in more detail. And you're all very welcome to the RCSI's MyHealth series. I might come to you first, if that's okay, Gráinne. When we talk about alcohol, it is very hard to separate it out from the fact that Ireland has a drink culture. And when we talk about health, trying to sort of hone in on the health impacts of alcohol, it's quite difficult to sift through how intertwined society and alcohol is here.
Yeah, it's a fair point, but actually culture often is influenced by price. So if you think about the price of alcohol many years ago, if we look back from 1960 to around the early 2000s, the amount of alcohol that was consumed trebled. So if it's really just an issue of culture, it should have always been at the same rate. And in fact, it has increased, and it's increased because availability of alcohol has increased, prices, it's much more affordable for people to get, and marketing has also increased. So you could talk about culture, but actually price of alcohol does influence culture, and with a reduction in price and where we can buy it in supermarkets, it's more accessible.
And do we need to sort of step up, I suppose, things like minimum unit pricing, those types of things? We always hear about, oh, in France it's much cheaper, or on the continent they do it differently. But they don't drink in the same way we do.
No, it's true. And I think the narrative of the individual changing their behaviour, yes, people need to change their behaviour, but that narrative is very much coming from the drinks industry. So it's very much about the individual person changing their behaviour, that the problems are just a few and the moderate drinkers are all very good. But in fact, what we see is that's not the case. The problem is a public health problem, and we should follow the World Health Organization guidelines, reduce availability, increase price, and limit marketing.
Do you have an issue around things like Drink Aware, which are about responsible drinking but are indeed funded by the drinks industry? Do the drinks industry have a role to play when it comes to public health initiatives around alcohol?
No, I don't believe they do. The World Health Organization would say that they absolutely should play no part. They have a vested interest. What they want is to make profit, as any company does, and any company has a right to do that. But it is about making profit. That's finding a market to sell something to people that harms their health. So they have no role to play.
Okay. That's very interesting. Ross, can I bring you in? We're going to talk about tobacco as well this evening. Obviously, tobacco has been one of the old staples in things like budgetary concerns. They go up and up and up the prices every year. But that wasn't the really big change that happened here in Ireland around our smoking rates, was it?
Well, it's a very important element of it. Just like Gráinne mentioned, price is very important. So the higher the prices and the higher the taxes, actually the less people smoke. And a lot of people stop smoking for that reason. So high prices is a good piece of the armamentarium that we have in tobacco control. You're right. It's not the only thing. In this country, we let out on workplace smoke bans about it only seems like a few years ago, but it's 16 years ago now since that occurred, and there's been tremendous positive benefits as a result of that. And if we look at the sort of smoking rates over that time, over that sort of 15 or 16 years, it's gone from around 30% of the adult population smoking to about 17% today. So there's been tremendous gains. And it's very important to remember that, cigarettes, smoking cigarettes, the way they were intended to be smoked, kills half of the users. So 1 in 2 people die who continue to smoke from tobacco-related disease. In this country, that's 100 people a week. So 100 people this week, unfortunately, will die of tobacco-related diseases. So any reduction in tobacco consumption, any reduction in smokers and the number of smokers is to be welcomed.
Okay. Of course, big tobacco has sort of morphed into big vaping and big cannabis. a lot of people talk about e-cigarettes and vaping as the solution to our smoking problems. What do you say to those people?
Well, we know there are things that help people stop smoking cigarettes, but stopping smoking is incredibly hard to do, Ciara. And that's because nicotine is incredibly addictive. And the delivery system in the cigarette is very, very efficient. So getting tobacco, or smoking tobacco, burning tobacco, inhaling all the compounds that are in tobacco, you do that ultimately for the nicotine hit in the brain. And inhaling tobacco is a really good way of getting nicotine into the brain. So if we can utilize that and try and help the addiction to nicotine that smokers, or most smokers have, we can help them quit, maybe. Now, we all know it's incredibly hard to stop smoking. It's very, very difficult, even with the best supports available and pharmaceutical assistance. You might have, and you've a really committed person, the chances are about 30-40% at tops. That's the best we've ever got to in terms of ability to have a successful quit attempt. So lots of people try lots of times. So they're willing to try lots of different things. So e-cigarettes then came along with nicotine and without the tobacco, and they've really taken off. There's been a massive upsurge in the use of e-cigarettes around the world. And the approach from public health communities around the world has started to differ. In the UK, there's a degree of promotion, and in the US and in other parts of the world, there's a lot more caution. They do have a role, I think, for the individual smoker, so less harmful. But it's very hard to think of anything more harmful than smoking tobacco, certainly smoking for a long period of time. So finding something that's less harmful than smoking cigarettes is not difficult to do. So, that's on that standard, it certainly is less harmful. The UK public health body would say maybe 95% less harmful. Some people would debate that, but certainly less harmful, but not harmless.
Okay, so are you saying that if you're a smoker, you're someone who smokes cigarettes, that if you move on to vaping, for example, that will be harm reduction for you? But is some of your, I think it's fair to say you're a little bit reticent to kind of promote it, is about the fact that there are people who are non-smokers, never smokers, who are now engaging with taking nicotine via a vape or an e-cigarette, and that is becoming a problem in and of itself?
Yeah, I think that's very fair to say, Ciara. So for the individual, and I have, unfortunately, see a lot of individuals who have smoking-related diseases, and I suggest they stop smoking as part of that, and we try and support them on that. And if they utilise an electronic cigarette to do that, I'm delighted for them. I hope that they're not smoking as well, okay? And then if they're on an electronic cigarette and they're not smoking, that's great. And then we might try and stop the electronic cigarette. That might be a harder challenge ultimately, but that's what we try to do. So for the individual, yes. The difficulty, I suppose, that and some of the challenges and the questions and the concerns that people have around electronic cigarettes is the regulation of them, the use of them by non-smokers, in particular the use of them by young people and children. And we're not seeing that as much yet in Ireland, although there is some data that is emerging as a problem. In other words, people who never smoked, who are now using electronic cigarettes. But certainly in the US, that's become a big challenge, to the extent that the CDC in the US has called vaping an epidemic. Yeah. And that's a big concern. Add to that then the companies that are now bringing us the vaping, which is big tobacco now by and large, and the concept of the reduced risk product that they call it, electronic cigarettes being one of those, and there are others. That's all well and good to the individual, but when we're talking about tobacco control and the public health, having these things available, having electronic cigarettes available in an unregulated way and to non-smokers, really there's no reason for a non-smoker to be using an electronic cigarette. And like most public health bodies and international agencies would agree with that. They shouldn't be in the young people's hands.
I'm really glad that Ross said that, Ciaran. Can we just discuss for a moment why people engage in these behaviours? Why do people smoke? Why do people drink? Obviously down the line, if they're addicted to cigarettes, it's obvious why they continue to smoke, but they didn't start off addicted, but they still picked up a cigarette. And the same question really for alcohol. Lots of people drink alcohol, but aren't necessarily addicted to alcohol, yet sometimes they still engage in harmful drinking. Why do we do it?
Basically because people like it. I mean, that's the part of the difficulty. I mean, nobody sets out to be addicted to anything, really. You know, they don't start like that. And I mean, psychologists have been looking at this for probably about 50 years now, and we still don't have a full panoply of exactly what's going on, because you have very, very complicated behaviours on the one hand. You've also complicated pharmacology. And then you put the two of those things together, you have an extremely complex system going on here with changes, some of it based on the drug side of the nicotine or alcohol, some of it based on the behaviours. So what seems to be happen for a lot of people is they start off and it's very reinforcing. You know, it's pleasurable. You know, the first hits and so on, alcohol is pleasurable. But then as time goes on and as people use cigarettes more often and use alcohol more often, get to a point where you're now smoking or drinking to prevent withdrawal effects. And that's a very different sort of space to be in, and that's quite challenging, you know. So I think what that means then is that from a public health point of view, the real trick from a government point of view is to stop people starting in the first place, and that's where we get into education and we get into looking at, you know, children and so on. It's interesting to hear what Ross is saying. I mean, the real worry with vaping is, I think, the children. It's marketed definitely to young people. You can see that particularly in the States, you know, that there's a very slick marketing activity, that you're seeing the rise of vaping in young people. And the same here, same with alcohol. Now, it's interesting to see the universities here in Ireland are starting to look at that in terms of situational factors and starting to think about how we change our environments for students, you know, so that, you know, alcohol is less central to everything that goes on within university. So I think they're extremely complicated behaviours, and your heart goes out to people who are addicted and who want to give up, which is about 70%, 65-70% of people who smoke, I think, would like to get off cigarettes, but they find that it's very difficult to do so. And then, of course, you've got huge vested interests, you know, who make a huge amount of money, including the state, by the way, if you think about it, in terms of, you know, tax and so on, you know, and keeping some of this going. So they're very interesting questions, I think, values-based questions about how we look at this as a state and as a society. So you have cultural factors, you have social factors, you have behavioural factors, you have pharmacological factors, and then you have individual factors. So individuals respond differently, or different, you know, genetic propensities to develop addiction. So it's not hard to see why it's very difficult for people to give up.
It's right you mentioned all those different factors that influence it. I think this is a question for both of you. Like I mentioned the likes of Drink Aware, and there is an argument that I suppose, despite the fact that they talk about harm reduction and drinking responsibly, they are a vested interest because they are funded through the drinks industry. But there are things that both big tobacco and big alcohol do. Like they have a playbook, I would suggest, and part of that is putting individual responsibility on people, put it back on the people, don't look at us. But things like the Alka-Pops or the fruit-flavoured vaping system, oh, blueberry, it sounds almost like it's one of your 5 a day. Do we need to get wiser and cleverer in how we combat, as people who have an interest in public health, the sort of insidious nature of addictions that are being fostered and generated among ourselves and indeed among our children?
Well, I think just, if I could just in terms of alcohol, actually the level of dependence at a population level would only be about, you know, the most recent estimate would be about 7%. So it's not unlike tobacco. Yes, dependency is a problem, but really the issue is on a bigger scale of the population level is harmful drinking. People binge drinking, drinking a lot, these heavy episodic periods of drinking that is really influenced by marketing. So at least now with the public health alcohol bill, hopefully that will be reduced in terms of young. Exactly, absolutely. But hopefully that one of the things where they're not allowed to have advertisement near, you know, schools or creches, where, because children, if you think about it, in the past, all of the images they have with alcohol, it's that it's a positive thing, that it's always very positive. They're educating them about alcohol. So I think that's a positive thing that hopefully will change.
Anytime I've ever spoken to any Irish person about binge drinking and I tell them how many units of alcohol are involved in a binge, which is 6 units or 3 pints, the response you get is, call that a binge. I'll tell you what a binge is. We do have a situation where we have sort of created a level of coolness around drunkenness in this country that doesn't exist in every country, and that is absent, I think, from smoking. I think smoking is now looked on by many people as something that they don't want to do, that is almost like a nuisance in their life. They have to go outside. We've created a structure where smokers would say, and groups like ASH would say, they feel slightly ostracised. No such equivalent exists with alcohol.
No, it's true. And I think part of it is there's, even using words like standard drinks, people don't really connect with what that is. So I think we probably should just start talking about grams of alcohol. And once we have labelling, because even if you buy a drink, all you have is the alcohol by volume, so you don't know what you're drinking. So you can do, complicated calculation and work it out, but nobody's going to do that. So until we have, you have a bottle that contains the equivalent of a pint of beer that states that this is 20 grams alcohol, at least it's going a little bit closer so people can actually understand what it is. We know from evidence that people don't even know what is in a standard drink.
Okay.
They don't know what binge drinking really is.
In brief, and I want to ask both of you the same thing as well, can you just maybe, Ross, highlight the actual harms of smoking to people? Because people sometimes forget.
Yeah, but I was going to go. Maybe we could just, in terms of that advertising piece, just with regard to. We all remember. Most of us can remember back to the Sunday paper day, and the back page was just a cigarette advertisement. And others in this country, it was other men or women indeed, But that's gone, and we don't see it anymore. So the cachet is sort of gone. But with the electronic cigarette, and Kieran alluded to this sort of promotion of these products, there is no mistake, or there's no, it's not by accident that these things have these flavours. They're not promoting these products to the man who's been smoking for 40 years, 20 cigarettes or 40 cigarettes a day, with, as you say, he doesn't need a gummy bear and this type of flavour, and he's not interested in that. So that's targeting a particular audience, and it's right out of the same playbook that tobacco came out from 50 years ago, as you say. And one of the things that, because the electronic cigarette, people aren't quite sure where to put this. Harm reduction, yes, but is it a great hype more than anything else with regard to further tobacco control? That those advertisements you do see around the place. You see them on the side of buses, and kids see them at the side, on billboards and so on. And a lot of them, actually, a lot of the children, because experience now would suggest, aren't really sure what's in them, and that the nicotine that's in them, which is incredibly, and I would contend that probably one of the more highly addictive substances that there is available is there. So when we smoke, and you asked about the conditions that we get, I said 1 in 2 smokers will die. They die of lung-related diseases, cardiovascular diseases, strokes, and other cancers. But there's hardly any conditions that smoking doesn't make worse, and there's none that it makes better. And so it is a unique product. There isn't a safe level. There isn't a, well, if I smoke 2 to 3 cigarettes a day, is that okay? And maybe when I go up to, I won't smoke any more than that. Unfortunately, there's no threshold effect. It's an all or nothing with tobacco. It's bad news. It wouldn't be available now. It wouldn't be regulated. It wouldn't be allowed as a consumer product. We obviously have a legacy of a long time now with it. And I think it's important to
It's very interesting you say that, because there's a huge push currently from certain quarters to legalise and decriminalise other drugs that, and for a long time, yourself and people like myself have said things like, oh, we wouldn't legalise tobacco today if it just was invented now. But there's an argument that we're moving towards legalising all drugs, harm or no, because we're changing as a society. So that's possibly questionable.
Yeah, I'm not an expert in other areas in addiction necessarily, but I think that we do need to be cautious on these things, and to be aware that the toll that they take. I think that you mentioned e-cigarettes and e-vapors and other things that you can put in the electronic form. So, for example, different types of cannabinoids, and the outbreak of lung injury last year was due to that, and bootlegging of these electronic devices. And utilised to inhale cannabinoid compounds rather than e-liquid necessarily.
Can I bring Gráinne back in, because you've elicited very clearly the harm that cigarette smoking goes, the harm that alcohol causes. Sometimes we hear that very much minimised. Gráinne, what would you identify as the harms caused by alcohol?
Well, I think not dissimilar to smoking, it can be devastating. I mean, we have to remember that alcohol is a psychoactive substance, as Ciaran alluded to. It's an intoxicant, it's toxic, it's addictive. There's nothing really good about it at all. And we know now, particularly the association with alcohol and cancer, we know that it is, a causal factor for at least 7 different types of cancer, particularly head and neck cancer, breast cancer. We know 1 in 8 women in 1 in 8 breast cancers are due to alcohol.
1 in 8 breast cancer. I'm
cancer.
repeating you deliberately. 1 in 8 breast cancers are due to alcohol.
Yes.
Those kinds of messages, up until relatively recently, were never out there.
No, but we're starting to see it now. I mean, alcohol is classified as carcinogenic to humans. Liver disease in Ireland has trebled in the last number of years. In fact, I was just reading a paper recently that was looking at the last 40 years of death from liver cirrhosis. A lot of European countries, it's going down. Ireland and the UK, it's going up, mortality. But we're not just talking about that. There's then intoxication. It's associated with suicide. It's associated with deliberate self-harm. So it's associated with a lot of things that may be hidden that people don't always see. And then, similar to smoking, there is second-hand harm. So I think with second-hand smoking was really what got people really, public health particularly, how can we change this and bring in different laws, but now we see also with alcohol there is second-hand harm.
So these are harms to families, to children.
Absolutely. So from people who are living with a drinker, but not even, it can be with colleagues. You have to pick up the work for somebody that's drinking, or they're coming in, absenteeism, people not presenting to work, or they do but they're not working, and absolutely children. They say there's 200,000 children who are affected by family alcohol.
And obviously it's a depressant, so there's a huge mental health fallout. You mentioned suicide. We have a high rate of particularly young male suicide. We have a high rate of young male excessive drinking. Are those two things linked?
Yes, so the current estimate is that almost 1 in 2 suicides are associated with alcohol. And what the evidence would also show is that people who have alcohol use disorder, so alcohol dependency, there's a much higher prevalence of suicidal ideation, suicidal attempts, and completed suicides. It's not just young men, it's also sort of middle-aged men as well.
Yeah, I want to bring you back in here. If we know all of these things, we know how much harm is there, and we will try and get back to what we would like to see change in terms of policies, etc. But if we know all of this, and it's complicated, and we know about the psychology behind it, can we harness that to help people to stop, to quit, or to reduce their intake?
I think we can, but I think it's very complicated. I mean, for many years the public health approach was, tell people about the harm and how bad this is for you and so on. The problem with that kind of approach is it creates fear. So I have 2 ways of dealing with that. I can either adjust my behaviour, or I can ignore the thing, so I reduce my fear. So scaring people doesn't work very well, but we've relied very heavily on it. So I think there are a couple of things. I think most people in trying to cut down or give up are on a journey with a number of stages. And the way behavioural scientists would approach it is say, well, the earliest stages when you're starting to, you're not even thinking about it. You're not even thinking about giving up or cutting down. It's kind of pre-contemplation. But then you get into the stage where you are actually starting to think, I might need to do something here. And you're thinking about the pros and the cons. And then if you get some support and help there, you get into this phase of sort of preparing to cut down. And that's really important, that I have a sense that if I do something, I may be successful here. I can get supports. I've thought about the barriers for me to cut down or to stop. And then I get into the action phase where I'm starting to cut down or wean off, and then again supports are very important. And then I've got to maintain that. And that kind of staging is important, because the way that you give information to people and what's important to people is quite different in those different stages. So this one-size-fits-all sort of education program doesn't really make sense in that context. The real problem with that, of course, is people go around, they get into that mainstay, and then they relapse, and that's really soul-destroying. And it takes a number of times, sure Ross will say from his experience
These
as well.
contemplative wheels of change.
So many times, eventually people may, particularly with cigarettes, people may be able to get off. But I think one of the really interesting things from the health provider's perspective is, we now have a mechanism, it's called motivational interviewing, that does seem to work pretty well, very helpful for people. It's not so much an authoritarian way of helping people along, it's working with them and solving problems. I think the real challenge for that, for medical practice, particularly for general practice, would be it takes time, and most GPs just simply don't have that kind of time of it. Neither do consultants in busy hospitals. You know.
So do we need? I mean, if I was going to ask all three of you just briefly, because we're coming to the end of the roundtable part of this evening, but all three of you, if you could, from your own perspectives, talk about how we would maximise harm reduction. What would you say we would need, Ciara?
I think the number one thing really is in relation to smoking is to stop children starting to smoke. I think, you know,
stop the recruitment of
stop
new
the
smokers.
stop the recruitment. You know, and the same with alcohol. I think the kinds of initiatives to change the situation or the environment of young people, where there's less reliance or there's less focus on alcohol. I mean, in Ireland, every single thing that's done socially, there's alcohol associated, and we've all. I mean, I have a generation we've grown up with that. But if you stand back and look at that in the round, it's a bit weird, really, you know, that we have to have alcohol for everything that we do, births, deaths, marriages, and the lot. So I think the stopping people starting, you know, getting in early is really key to this. Yeah.
What would you say, Gráinne?
No, I would agree with Kieran, but I think really for alcohol, it's price, it's marketing, and it's availability.
Okay, and so and that's at a policy level, really,
Absolutely.
more than simply at an individual level.
Absolutely, but an individual can help themselves. I mean, I think it doesn't even need to be motivational interviewing. Some people would be sufficient with a brief behavioural intervention with their GP, just, you know, just discussion about their alcohol, because often people don't realise that they're drinking too much and they don't realise the harm. So they could actually quite easily change their behaviour.
And Ross, what would you say?
Yeah, I think stopping starting is absolutely vital, particularly with kids. That's where they start smoking. But we also need to support the smoker, because as Kieran alluded to there, you know, 3 out of 5 smokers, if you ask them, they're thinking about, or they're in that cycle of thinking about or wanting to or trying to quit. Yeah. They find it incredibly hard to do so. And actually, while we have ramped up a little bit with regard to the supports for them, it's still very... you know, there's still quite a bit of lip service to it, and it's not really, you know, you talk about motivational, behavioural supports, even the stuff that we know works, and we're talking about, you know, e-cigarettes versus other types of nicotine replacement therapies and other pharmaceutical agents that work really poorly prescribed in this country. So, you know, we need to actually try and help the smoker who wants to quit, and we know most of them do. And I can tell you that there's an awful lot of people who go through interactions with their healthcare provider, and certainly in the hospital environment, where they come back out the other side and no one ever asked them. Yeah. Which was fine, you know, and no one ever asked them did they smoke, and they sort of got away with it. And a lot of them are expecting to hear, but they don't.
It's dreadful to think that still happens. But look, my thanks. That concludes the round table part of this evening. My thanks to Dr. Gráinne Cousins, to Dr. Ross Morgan, and to Professor Ciaran O'Boyle. We will proceed now to the public lecture part of this evening.